So I was saying the whole experience has generally been good. Having got in touch with the 3H and give them what the problem was, the connection they did for me, and the documentation they processed for me until I ended up arriving in India, how they treated me, picked me from the airport. The people I was given are the exact people I met at the airport. And they took me straight to the hospital like we had arranged, because I talked to them and told them that I had little time. I wanted the procedure done a little faster. So they had already arranged with the doctor. The doctor was aware. I was picked from the airport together with my wife, who went straight to the hospital. The doctor was there to see us. He started investigations. He admitted us immediately to the ward. He started with an investigations. And as per schedule, the operation was done on the 25th, because we had agreed that if it were possible, we'd reach there on the 23rd, examine the procedure starts, and the operation is done on the 25th. And exactly on the 25th, the operation was done. So this is wonderful. And this is something unexpected. Something unexpected. Whatever I was told from there is maybe the payments were nearly the same that I found here, although there were a little bit of adjustments because of the complications of the case that I had. Ours was a little unique because the hip had already completely got worn out, and then the procedure that he said he did was a little bit improved. He was telling me that the edge was a little bit tender, and he thought I should have that specific implant, so that takes a bit of time. So I'm generally happy, and up to now 3H is still following and making sure that we are comfortable wherever we are. They gave us where to stay. It may not be the best, but it's okay, it's comfortable. I have not come here to enjoy. I have come here for treatment, and I love to get my treatment and stay where I can afford within the time of the stay. Maybe when I come for tourism or other sightseeing is when I can maybe choose where to go. But what they have done for me is really wonderful. They were a call away. Anytime we called, this young man, is Vic, would always be there to stand by. Whatever we wanted from them, they would always come. You, your boss, you came to see us in hospital. This is wonderful. I didn't expect this. We don't have relatives in India, but you became our relatives. When they see you in hospital, you get energy. You feel you are okay, because there's somebody asking you, how are you? If there's nobody asking you, how are you, how can you say you are okay? And there's also nobody to see you and say that there's a difference between the time you are admitted in hospital and now. So generally, your services are great. And I wish so many people knew about them. The problem is, I think you need to do a little bit of, advertising, especially to some parts of Africa, to some of our countries, because we have so many people who are sick and they are quietly dying, and yet they could afford this kind of treatment. They could afford really, if they knew that such facilities are available. People fear that I'm going to a foreign land, they will eat me up, they will arrest me, they will what. But when there are people like you, it will be very, very fine. It will be okay that if they go to know, they should be able to have their issues, their problems rectified. As of me, I'm excellently happy. I am not healed, but I think I'm in the right process of recovery. I'm on the road to recovery. I can see myself that I'm on the road to recovery. The pain that I used to have, the lot of pain that I used to have, is no longer there. I'm just working on my muscles, and I think I should be able to walk and resume my duties as soon as possible. But in all, I thank you, because I was wondering how I was going to have this done. I had feared to do it again in my country, because I'd had several operations already in that country, until I came across you, and then you gave me the information regarding the availability of these services in India, and at a reasonable price that I know we can readily afford. So I'm living knowing that at least there are people out there who care for others. Yes, who care for others, who treat others really like their own, who care about the problems that they explained to. So I wish the world was aware of, the whole world was aware of that. I think such, the differences between what we don't have and what they have can be what? Bridged. Because if we don't have this and you have, we have the patience, you have the skill, then we can bring in the patient and you work on them. We all benefit. We go with good health, maybe you'll get the money. There's no problem with that. All in all, what we want is good health. All through we're taken around, we're guided. I know if we had wanted to move around, we could have moved, but I have yet come for sickness and I'm still sick. I don't want to sightsee, whatever. I'll come to India another time when I think I'm okay. I'll be able to come to India. And I have friends out there who will be excited seeing me back. And they will definitely be asking, how did you manage? Who connected you? I will tell them that there's a wonderful 3H. They did the job. They did a wonderful job and got me back to my feet. I thank you very much. I'm grateful for whatever you've done, and I hope we'll remain friends forever. I will always tell people about your company and how wonderful the people work in it are, how you treated me together with my wife. We are happy. Thank you very much. Yeah.